Welcome back to my channel. Today I'm going to continue the topic of cultural safety from Cmpa website Good Practice. As we all know that Cmpa website is giving us a lot of good practice in which we will be able to understand more about the QE1 ethical portion, and this is very important part of MCC QE1. So if we are going on this website and then you click on the good practice, you will find this professionalism and ethics, and I'm going to start reading cultural and safety. I have read two more topics in the past, professionalism and boundaries. You can have a look at it. So let's get started. Cultural influence on health and disease management. Introduction. Culture incorporates a mix of beliefs and behavior through which people define themselves and conform to societal expectations, norms, and values. Language, customs, rules, values, even products and institutions are all culturally specific. As we know that culture is the basic and very important part of our life, not as an individual, but whenever you're working in a workplace, there is also a cultural things which you have to make sure that we are doing the safety things that can incorporate into that culture. Canada diversity means that patients and physicians alike come from many different countries. As we all are IMGs, we are coming from different backgrounds, and we are looking after the patients who are coming from different backgrounds. So it's very diverse. Patient-physician relationship is strengthening when practicing a multicultural mindset. It's always important that we look for a mindset that we are respecting norms and values of every culture, whoever comes to meet, like a patient, like a physician, like a colleague. Culture may affect a patient's interpretations of symptoms, coping strategies, and approach to health, impacting their level of engagement in the care planning, choice of treatment, and adherence to the treatment. These are all the things which we see when a patient is coming to us. They might see a symptoms differently. They do have a coping strategies which is very different. Sometimes they don't even put their 100% in getting an engagement into the care plan. They say whatever the doctor say, it's good for us. And sometimes adherence to the treatment, they are not able to do it for XYZ reason. That also come from their cultural part. By missing clues or misunderstanding of a patient's cultural viewpoint, it is possible for healthcare provider to unintentionally offend or place or diagnosis, adherence to treatment, and health outcome at risk. So this is one of the important thing, because we think that patients should be, we cannot treat everybody on the same level, because everybody coming from different culture. If we are not understanding their viewpoint, it's unintentionally missing some clues, or maybe we are trying to do some diagnosis which might not be appropriate. Let's suppose adherence to the treatment. If we talk about a patient is just fasting, they are not able to take their medication for initial 12 hours of the day, because they are not supposed to eat. So that will make us that they are non adherents, because they are not taking their medications twice a day. But this is not which they are trying it to intentionally. This is because of their cultural influence. So we have to understand that part, and we have to adjust those things according to the individual needs. While it is common to speak of cultural awareness and cultural sensitivity, it is also increased recognizing of importance of cultural competency and cultural safety. Whenever we are talking about awareness, we are talking about sensitivity, which is a part of the culture. We have to look for a competence on that culture, as well as we are providing the safety, whatever the culture belongs. Providers who use their knowledge and skills to provide effective health care for patients to diverse cultural backgrounds are said to be culturally competent. We have to be culturally competent when we work in the Canadian healthcare system. Why? Because everybody is coming from different backgrounds, they have a different culture. If we are trying to respect and we are trying to provide the care effectively on the basis of each and individual's culture, then we will call it as a cultural competent. Competency required a blend of knowledge, convictions, and a capacity for action. Clinical cultural competency includes being aware of the patient's and one's own socio-cultural background, and using skills and strategies to minimize the bias while focusing on culturally appropriate healthcare intervention. Our background is different, patient's background is different, and there is always a level where we might get biased, but we have to focus that how can we minimize those bias by not getting influenced by our culture or their culture, and we provide an appropriate care, let's suppose intervention or something. So that is called the cultural competencies. It also include an understanding of power differentials between patients and physicians, enabling patients to become more active partners in their healthcare. There are many things which we have to look for whenever we are trying to give appropriate care to the patient. As a physician, we always make sure that we are involving our patients in their treatment as much as possible, but sometimes, as being on the difference in the powers, because at some point physician is always on the superior side as compared to patient, it's in therapeutic relationship. So that gives a difficult point, and we have to enable the patient, we have to explain the patients that they can be more active as a partners in their own healthcare, and they can be a part of circle of care by successfully leveraging their cultural competencies to adapt their interactions with patients. Healthcare provider can help their patients feel safe in expressing their different views, priorities, and preferences, and thus providing cultural safe care. So let's get an example. Let's suppose if a patient is a Muslim, they are coming during the period of Ramadan, which is the where they are trying to do fast, and they are doing fast for 30 days. If someone is not aware about that fasting, how the fasting works, from which time to which time they are not able to drink or eat, and if you are not aware of that, you can ask them, I'm not pretty much aware about your fasting, can you explain more about that, so that you can try to adjust the medication on that time duration, so they can take their medications but they don't have to break their fast before the times comes. So in that way, you can see that you have a different point of view. You thought, why not in the morning, but once you ask the questions, it helps you to understand and their culture, and that helps you to manage the situation accordingly. So that gives you a perspective that you are trying to give a care which is culturally safe. You respect their culture. You did not try to explain them that this medication should be taken at a specific time, but you said, okay, and during this time period we can try to adjust that. So that means you are providing a care, and that feels safer for the patient too. There are 4 different parts of this cultural safety topic. I'm going to read the first one, which is the wide spectrum of the culture. As we all know, wide spectrum of the culture means culture can be from any part, from any way, and it has a very different perspectives and very different spectrums. It is important not to assume to know or understand patient's need. Respectfully asking how patient want to be treated helps build trust and engagement. That's what I just give an example of. Getting a medications during the fasting time is also good, that you have to ask the patients what their preferences are. They would say, okay, I can take before I start my fasting, and I can take after I break my fast. So that can help you to get it, and that will help them to engage into their circle of care. While members of an identifiable ethnic group may share common values, there is a potential diverse range of personal preferences and opinions within the group. Even though you and the patient is coming from the same ethnic, still they might have different preference and opinions. You have to respect that part. Be careful to avoid stereotyping. Stereotyping tends to be limiting or may often judgmental and negative. That's why never assume anything. Ask if you don't know. That's very important, and that gives you that you are being a culturally competent, and you're respecting the norms and the values of each patient according to their background and culture. Peoples will conceptualize their illness and require treatment differently based on the number of factors, including cultural background, spiritual beliefs, prior experience, and educational levels. Person's response to recommendations for care will be shaped by their previous experience with their healthcare system, their cultural and personal preferences and religious beliefs, and their capacity to adapt. Even within one family, there might be a significant difference in acculturations, intergenerational tensions, or between first and second generation immigrants and their families are not rare. So not rare means it's very common. So if we talk about these points, they are just saying that whenever a person is coming to you for any reason with their illness, they always require some different treatments because of their cultural background. Let's suppose if I'm talking about a patient, whenever they have a sore throat or they have a flu or common cold, they always think that antibiotic is the best treatment for them, because they have been coming from a background where cultural background says that okay, this is the only antibiotic which works on my illness. So they might ask you that. That is a number of the factor. If you feel that he needs antibiotic, definitely you can go for it. But if you feel no, this could be a viral infections, as the virus is going around, you can try to elaborate their previous backgrounds, and you can try to tell the response in a way that they don't feel that they are being neglected, but they are being treated in a normal way. Spiritual beliefs, it's very important. Everybody have their different beliefs, and we have to respect that part. So, and it's not our job to make sure that we are knowing all the spiritual beliefs, all the religious values. If you don't know, you can ask for it, and that will help them that okay, doctors respecting my beliefs, doctors is respecting and asking for my religious point of view. So that would be great, because they will be feeling engaged into their care. Prior experience, same kind of a thing. If they have a previous experience from some other doctors who used to understand the things of the cultural point of view of the patient, but they will feel, oh, this doctor is going to do the same. But no, every doctor is having different way of understanding the cultural, so they will feel like that way. Or they might say, oh no, there is no doctor who can feel like they can understand our culture, because they don't know us. So they try to explain everything, but you are coming from the same culture and you might understand more than. So their previous experiences could be helpful in that situation. Education, it's not something we are asking that oh, someone, a literate patient or a literate person will have the higher level of understanding, or the lower literate patients will have the lower. As a physician, we always try to treat everybody as simple as possible. We don't say oh, he's a educated businessman, so he will understand with simple words, but the person who is not literate, have never been educated, they needs to be more explained. No, it's as a being a physician, our job is that we try to explain them as simple as possible, that can help them to understand. Whatever their education level, it does not matter to us. It could be good for them to as a receptive point of view, but for a physician point of view, our way of explaining should always be the same. A person's response to recommendation for care will be shaped by previous experience, the cultural and the personal preference, especially the religious beliefs, and the capacity to adapt. How good they can adapt the things. That's why we say the teach back. Teach back means whatever I told to my patient, I will ask them, do you understand? They will say, oh yeah. Then I'll say, can you explain it to me? That will help me to fill the gaps where they did not get it, but they felt that they get it. So that's the one thing which you have to look after. Even when one family, different generation, different people, different environments they are living, they might have been someone who is the second generation, has born and brought up in Canada, but the first generation brought up back home, so they will be having a different perspective. This is all about the first part of the cultural safety. I hope you like this video. Please share your suggestion, or if you have any specific questions, you can let me know. But in terms of explaining more about this and about the 3 other parts, I will try my best to explain in the different videos, so it will be shorter and more interactive. Please share my video if you like it, and hit the bell icon. Whenever I'm getting the new video, you will get it. Thank you so much.